Welcome to Legacy Magazine presents Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Good afternoon and welcome to Black Health. I am your host, Dr. Michelle Kirwan Blythewood. I am a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. Today, we are talking about adult vaccines. Conversations today around vaccines are typically focused on COVID or childhood vaccinations. But did you know that every year between 50 to 90,000 adults in the United States die from vaccine-preventable diseases or their complications? And it isn't necessarily that people don't want them. Many adults simply don't know they need them. Today, internist Dr. Carmel Barrau will walk us through some of these adult vaccinations that could save your life or the life of a loved one. Welcome, Dr. Barrau.
Thank you very much, Michelle. I appreciate the invitation to come to your show and present to the public at large some very pertinent information about adult vaccination.
Thank you so much for taking time out of your busy schedule. I know you are a busy physician, so we appreciate having you. And we also appreciate the knowledge that you're going to bring to the table. You might be saving some lives today, Dr. Barrau. But before we get started, can you tell us a little bit about yourself? Give us a little introduction.
Yes, I'm Carmel Barrau. I was born and raised in Haiti. I came and did my specialty at University of Miami, Jackson Memorial Hospital in internal medicine. I'm board certified in internal medicine, and I decided to stay in the community to help the less fortunate. My office is right there on 95th Street, essentially between Overtown and Little Haiti. I've decided to remain in the community. In addition to that, I've decided to do even more. About 13 years ago, myself and many others, we opened the new College of Medicine at FIU. In addition to the College of Medicine being a founder of the College of Medicine, I'm also the head of the Dean Council for the College of Medicine. So we try as much as possible to encourage and empower minority kids to choose the career of medicine and have a chance at getting accepted there. So this is, to that effect, I also opened a scholarship allowing to defray the cost of such endeavor, as we know many families may not be able to sustain themselves while their kids is in medicine school. So we've also have a scholarship for that. I'm also the president-elect of the Dade County Medical Association, soon to be the president in June. I hope that you will be attending to the gala. So, and I also own my own private practice right there on 95th Street, where I've been practicing for about 30 years now.
Wow, you're a busy man, Dr. Barrau, but you're doing some wonderful things in the community. I actually didn't know that about FIU and the scholarships that you all have in place. That's really great, because we definitely need to recruit more minority students into healthcare. So, Dr. Barrau, when I reached out to you to be a part of this podcast, you suggested doing talking about adult vaccinations. Why do you think it's important to have this discussion?
It's a very little known subject. If you ask physicians and patients alike, their perception is vaccination is for kids. That's not true at all. Many vaccines are absolutely necessary for the adult population, and some of those vaccines could be essentially life-saving if received on time.
Are adult vaccination rates lagging? And if so, why do you think that?
Absolutely. Lagging to the point that the American College of Physicians, which is I'm also a member, started a special program in Florida where they would encourage physicians to learn about adult vaccinations, but also expose to the public the reason why adult vaccination is a very important subject. Yes, we are lagging behind. And for the last 2-3 years with the COVID pandemic, that lag has even increased to the point that now in the office, I'm making a significant and concerted effort to get people back on track regarding adult vaccination.
Yeah, we had to get kids back on track after COVID or during COVID, post-COVID. So I can imagine must be even more so with adults. And, to be honest, Dr. Barrau, I'm a physician, I'm pediatric, so I'm obviously focused on pediatric vaccinations, but I myself, I don't even think about vaccinations for myself. So when I saw the topic, I was like, this is this is very necessary even for me to hear this session.
Well, come to see me. I'll put you up to date.
Thank you. So, Dr. Barrau, if someone is missing some of their childhood vaccinations, is it just too late? Sorry for you, or can they receive them as an adult?
Oh, no, they do. They can receive them as an adult. As a matter of fact, one of the programs that we run in the office, we help people that are migrating to this country or wish to become a legal citizen here to be up to date with their adult vaccination. So it is never too late to be vaccinated against certain diseases, even if you believe those vaccines were for quote unquote kids only. Absolutely. Even if you missed the vaccination during your childhood, okay, you still are entitled to that vaccination as an adult.
True or false? Immunity from childhood vaccines can wane or decrease as we get older.
It is so true that immunity as an adult can wane and become so below the level of protection that you may develop the disease that was intended for you to be protected against. Okay, that's the reason. Right.
So how do we know if that has happened, and how do we know if we need to repeat certain vaccines?
Statistics. I mean, if you've been vaccinated for after a certain number of years, for example, let's take an example like tetanus. If you've been vaccinated and it's been 10 years since you've not received any vaccination, you must assume that you are not really much protected against tetanus anymore. You're going to need what they call a booster dose. And that booster dose is given about every 10 years or every 5 years if there's a problem.
Okay, so it's figured into the vaccine schedule. The
Absolutely.
ones that they feel will wane over time, they figure that into. Okay. So let's walk through the list of recommended adult vaccines one by one. Who needs it? What age we need to get it? What it prevents? We can start with COVID. I think COVID, we've touched on this show many times, but obviously we don't want to bypass it. If you want to say a quick word about COVID.
Yes, it's been we've been at it since the pandemic and since the vaccine became available. I will leave it up to you to decide COVID vaccination in children, but in adult, it's absolutely paramount. Not only to protect yourself, but to protect people around you. Some young patients say, if I get COVID, I'll probably get by and I'll probably won't develop any significant complication from it. Perhaps, but you can bring the COVID to your parents, to your grandparents, to elderly patients that are frail and not fully protected against it. So by creating what they call a herd immunity, by vaccinating everybody around the sick and weak patients, we may technically protect them by creating a barrier of vaccinated young patients around them to prevent the virus from reaching that population. So even though COVID might be seen as at-risk patients only, I would suggest everybody to get vaccinated.
Yeah, and that herd protection is really important for patients who can't have a medical contraindication to receiving the COVID vaccine.
Absolutely,
as well.
Absolutely.
How about shingles? What is shingles?
Shingles is describe it is when you have significant pain somewhere, you have no idea what it is, and all of a sudden a few blisters start rising. It becomes red, tender. I mean, you feel like you really have been almost stabbed. I can tell you some people have got treated for acute myocardial infarction, which is heart attack, acute gallbladder infection, appendicitis, okay, with the onset of shingles. And the worst thing about shingles is what they call the post-hepatic neuralgia, is the pain that sustains for months sometimes after the shingles has itself resolved. Not taking into the facial disfiguration that you may encounter if you have the shingles in your face. And some people have lost vision in one eye because of shingles. So it is not something to be taken lightly. The shingle vaccine is for adult 50 and over. It protects the people that have had varicella, which is chickenpox, as children.
Well, if that didn't convince everybody to go out and get a shingles vaccine at the age of 50, I don't know what would. So what is the recommendation for adults who have never had chickenpox?
Well, first of all, let's define adult who've never had chickenpox. Many of my patients tell me, I didn't have it when I was children, and I didn't get vaccinated, and I do a titer, and it's positive. That means you've been exposed to it, and you have the germ diluted in your system somewhere, waiting for the moment to show up again. So even though you didn't have it or do not recall you had it, you still have the germ. So those patients needs to be vaccinated. I've seen only one case who was totally negative. I suggested to him, go and get the chickenpox vaccine. You don't need the varicella vaccine, but you still need to be protected against chickenpox, because chickenpox is much more dangerous in adults than in children.
Yes. Okay. Pneumococcus.
Pneumococcus, it protects you against certain type of pneumonia. It's not a virus this time. It's a bacteria, and that bacteria, can cause pneumonia. 150,000 people in the United States get admitted to the hospital with that type of pneumonia. So it is a very bad disease, okay, particularly 65 and above. We have two vaccines for that. We have the Pneumovax, which covers you against 23 different subtype of pneumococcal germs, and the Prevnar 20, brand new, that covers you for another 20 subtypes of this nasty bacteria. So it is very important. Now, some people may not have to wait 65 to get it. Let's say, for example, you are immunosuppressed for some reason. You have to undergo chemotherapy, radiation. You may ask your primary care provider to provide to you that vaccine at a much earlier time, because those treatments or those diseases might put you at risk for developing bad pneumonia.
Okay. Human papillomavirus, HPV.
Well, very controversial vaccine when it just came out, okay? It's supposed to be for kids 8 to 11, sometimes up to 13. It was originally only for women. Now it's for men and women, most of the time in their teenage. Okay, some patients, if you are an adult and you've never been in contact with the HPV and you wish to have it, you may speak to your primary care provider to still have it, even if you are an adult. The reason why that HPV vaccine is important, it prevents cervical cancer. A male can say, well, I don't have a cervix, so I don't have to worry about that. Yes, but you might transmit it to someone who may develop cervical cancer. So very important that you get vaccinated against HPV to prevent cervical cancer. It's one of the most highly preventable cancer in modern society, which is human papillomavirus.
Have rates of cervical cancer gone down since we've introduced the HPV vaccine?
Absolutely, because more patients get vaccinated, less patients get infected by the particular subtype of germ that causes the cervical cancer, so less patients get cervical cancer. So absolutely, it's been proven that the rate of cervical cancer, at least in developed countries where the vaccine is available, absolutely, the rate have declined.
Yeah. What is the age limit for HPV vaccine? Is it 26?
It's about 26, but like I said, anybody who wishes to have it and you think that who get tested, who have never been exposed to it, but feel that they may be at risk, new lifetime change, you never know, new partners, etc., okay, they may want to still obtain advice from their primary care doctor and get vaccinated. Remember, Dr. Kirwan, sometimes medications or procedures can be used out of sequence, in the sense that you may not technically qualify for something, but your primary care doctor or your specialist may decide to still apply that treatment or that prevention to you because of unique circumstances. So it's always good to seek a second opinion, even if you will be beyond the 26 years old.
Okay. I always wondered about that age limit for HPV, and why wouldn't they consider giving above the age if you are at risk. So
Because
that's
statistics have proven that past age 26, the vast majority of people have been exposed to the germ already. So giving the vaccine will not make any changes. But you may find some unique cases who are HPV negative and wishes to be protected.
Okay. All right, next vaccine, meningitis. What is meningitis? How common is meningitis?
It's not a very common disease, but it is a very devastating disease when it happens. It's the inflammation of the membranes around the brain. If I want to put it in a very simple way, it's like an inflammation and an infection of what surrounds the brain. It is so important to be vaccinated against it, particularly young adults, people that are living in crowded situations like college dorms. Those young kids needs to be vaccinated against those type of meningitis, because this disease can cause death, can cause significant disability. So I encourage anybody that is going to college who lives in a very crowded situation, particularly if you're young, to have your meningitis vaccine. I believe it's 2 doses, and it protects you against the most common and most lethal form of meningitis.
So we start in pediatrics, we start giving the meningitis vaccine at the age of 11, 2 doses, like you said. Is there an upper limit age-wise for the meningitis?
Generally, that the adults that I see myself, I mostly see 65 and above. No, we do not necessarily prescribe, because what happens is the base of the brain where the germ tends to fuse in and enter the brain is completely calcified at that age. So the way that the germ were to penetrate the meningia is kind of blocked. So it is very difficult for a very well adult, I might say, to have meningitis. Having said that, you still can have meningitis from other source like the blood and other ways. But in my practice in general, we do not necessarily advocate the meningitis vaccine at 65 years and above.
Okay. You touched a little bit earlier on tetanus, but let's review that one again. Tetanus, you said every 10 years. And what is that tetanus vaccine for?
It's against tetanus, obviously. It's a disease that once you get it, you become very spastic, you can't breathe, you can't move, etc., and it may cause death. It's a very lethal disease. How do you get tetanus? Most of the time, infected needles get caught in a situation where the wound is deep and soiled with soil and so on and so forth. This is the way in general people get tetanus, and that could be lethal. So the reason why every 10 years, because like we said at the beginning, in the immunity against tetanus tend to go away with time. So we've adopted the policy to vaccinate every 10 years to maintain the immunity. Having said that, if you come to the emergency room with a bad wound, soiled and deep, and it's been 5 years since you get vaccinated, you probably will get another dose, because it is really that wound is so infected, so potentially infected, that the vaccine may not work well in that situation. So you may get vaccinated again. And the last thing, the tetanus is given with pertussis. It's Tdap versus TD. The Tdap, you replace 1 dose of TD with Tdap to boost the immunity against pertussis, Bordetella pertussis.
So go ahead and talk about pertussis. That's actually next on my list.
Yeah. Okay. Pertussis is a disease. We call it whooping cough, right? We generally vaccinate children for whooping cough, but we've seen a resurgence of whooping cough in the adult population. Okay, so the way to protect you against it is to make sure that you've had your vaccination as a child, but you get 1 dose of pertussis for every 10 vaccination against tetanus. That means if a patient of mine come right now and it is his time to get vaccinated, to get boosted against tetanus, I will replace the TD with the Tdap, which is acellular pertussis, to protect him against the whooping cough.
Okay. Influenza.
Influenza It's a common flu, okay? The CDC estimate the season at least 25 million illnesses. Thanks to COVID, we didn't have that many cases for the last 2 years because everybody was washing their hands, wearing a mask, etc., etc. So the influenza virus was really upset with COVID because it couldn't spread as much as it used to in the past. For example, in the 1917, with the Spanish flu, more people passed away from the Spanish flu than in the First World War, to tell you how important this disease is. So 280,000 hospitalizations are expected for this particular season. 18,000 deaths are from the flu, 18,000. So it's not a disease that we should look at it lightly, okay? The flu vaccine is very safe. I take my flu shot on a yearly basis. It protects against certain varieties of flus. Not every bacteria or virus that can give you a sore throat, a little cough, body aches will be protected against that vaccine. But the one who can potentially kill you or send you to the hospital on a ventilator is the one that most likely you will be protected against.
Yeah. Incidentally, right now, I think my husband has the flu. And I have not gotten sick, and I have been next to him every day and not touching me at all. And I had my flu shot. I had the flu several years ago. And when I tell you, it kicked my tail for a week. And from then I said, I will never miss a flu shot again. It's just not worth it. Right. And I'm so thankful I got it because I started the first day that he was sick to get a little scratch in my throat, a little runny nose, and then it all just disappeared. So
well, as a matter of joke, and I say it's a joke, if you cough on your computer, you might activate your antivirus.
I've never heard that one, Dr. Barrau. I like that
Even
one.
the computer doesn't want to be infected, trust me.
And neither do we. All right, hepatitis. Let's talk about hepatitis A first. There's three
types. There's multiple types of hepatitis, but the two ones we have vaccine against are the A and the B. Okay, the hepatitis A is contracted through fecal oral. That means you eat or you drink something that is infected. You get nausea, vomiting, yellow eyes. Your liver get inflamed and so on and so forth. I will pass you the details. We can protect you against hepatitis A, particularly if you live in an area where it's endemic or you intend to travel in certain areas that are endemic. Okay, I would suggest you to get your hepatitis A, particularly if you're going to be consuming questionable food and drinking questionable water in that area. It is very important that you get your hepatitis vaccine. I believe it's 2 doses. It protects you.
Hepatitis A can actually
Yes, absolutely. Now, hepatitis. I'm sorry?
No, I was just going to say hepatitis A actually starts at the age of 1. That when we can start that at the age of 1, very young, including through adulthood. Yeah.
Mm-hmm. Okay. Now, hepatitis B is something that is acquired through transmission, serial transmission, I might say. Okay, infected syringes. It used to be blood transfusion in the past, but the blood is being screened so aggressively nowadays that we hardly ever see cases of hepatitis B transmitted through blood transfusion. It could be transmitted through plasma, to platelet transfusion, etc., and also to unprotected sex and so on. Anything that has to do with contact with mucosa and liquid can transmit the hepatitis B. Again, it's a 3-dose. The first dose now, the second dose a month later, and the third dose 6 months later should give you ample protection against hepatitis B. Mostly adults that are at increased risk, like dialysis patients, immunosuppressed patients, certain patients that followed a certain lifestyle or certain sexual lifestyle need to be absolutely protected against hepatitis B. us physicians, we should be, because we're in contact with patients and we never know who has it, who doesn't have it. You might want to give an injection to a patient, you get yourself stuck with the needle. Okay, so those type of things can happen, and definitely people should be protected against hepatitis B. There's no reason why people should get hepatitis B nowadays.
Yeah, and we actually give that in the pediatric population at birth in the hospital. The first Hep B vaccine is at birth, and the second one a month or two later.
Okay.
So are there any other, how about HIB, any other HIB and any other adult vaccines?
HIB, which is Haemophilus influenza vaccine. Okay, it's not the flu, it's Haemophilus influenza, which is a bacteria. Yes, it's not something given generally to the public. It's specific cases where people are immunosuppressed because of a problem with their immune system, like a spleen problem. People with sickle cell disease who have essentially no spleen left after multiple episodes of sickle cells. People that underwent splenectomy because of a bleeding problem or what have you. Those people definitely should be getting the vaccine to protect it against encapsulated organism. Particularly pneumococcal vaccination also is needed in those situations. So it's a rare vaccine, but definitely if you had a problem like that, it is very important for you to get protected. There are some rare cases where people are inherently sensitive to encapsulated organism. Those people, when discovered, they have recurrent infection with encapsulated organism. Those people should get the HIB vaccine, not HIV vaccine, HIB for B. Okay, to protect them against the influenza, the Haemophilus influenza germ.
Are all these, so I think that concludes all of our adult vaccines. Is that correct?
We can, it's about, we'll touch briefly about the MMR, but generally it's given during childhood. But obviously, if you're not protected against those, okay, you might want to get a booster dose when you go to your primary care office.
Okay. Are these vaccines, the ones that you've spoken about, safe and recommended for pregnant women, or any of them?
Most of them are safe and recommended for pregnant women, except the live attenuated vaccine, like the MMR, the varicella. Those should not be given to pregnant women.
And are elderly people or people living with chronic diseases like diabetes, hypertension, are they more susceptible to some of these vaccine preventable illnesses?
Absolutely, because diabetes inherently decreases the ability of your immune system to respond to a certain disease. I would definitely encourage people with diabetes, chronic diseases like COPD, cancer, HIV, to be fully vaccinated against those diseases.
And is vaccinating adults in a household, is that protective for infants or children living in the household?
Well, it depends on what the situation is. A vaccination against herpes zoster, since you cannot, you're not really gonna be able to transmit it this way, may not. But most of the time, if you can't get COVID, for example, you cannot transmit it to the next person near to you. If you cannot get pneumonia or the flu, you cannot transmit it. Obviously, vaccinating creates a herd immunity that protects other people living with you.
Okay, I think we're coming close here on time, Dr. Barrau. Any final word of encouragement that you'd like to give the audience in terms of getting their adult vaccinations, and how can they reach you if they would love to get their vaccines from your office?
Well, we are right here in the community. My office is at 1190 Northwest 95th Street, Suite 406, right there in the North Shore Hospital Medical Office building. My office is separate from the hospital, but we're right there on campus. If anybody wants to come and get us, speak to us. We're all happy. We'll be happy to advise anyone about their vaccination.
Great, thank you. And lastly, a word of thanks to our sponsors. Black Health is brought to you by FAMU Medical Marijuana Education and Research Institute. Get credible information and engage in a safe space to learn and talk about cannabis. Educate, learn, and talk about cannabis in Florida. And tune into Legacy Magazine's other podcasts for the week. Mondays, The Business of Black Business at 1 p.m. with Jay Reynolds. Tuesday, My Money, Your Money at 7 p.m. with Bridget Lumpkins. Wednesday, Soul at 7 p.m. with Nikki Gellin. Thursday, Lunch with Legacy Leaders at 12 noon with Anne-Marie Sorrell. And Thursday, Taste of South Florida at 7 p.m. with Chef Irie. And as you know, Fridays, Black Health, hosted by me, Dr. Michelle Kirwan Bythewood at 2 p.m. So we will see you soon on Black Health. We thank you for tuning in. Dr. Barrau, thank you so much. This has been excellent information. I actually learned a thing or two even as a physician. So we really appreciate your time and your input, and you're taking the time out to educate the community. Thank you. And I'm sure we will see you again on Black Health. And to our audience, thank you for tuning in, and we'll see you next week. Bye-bye.
Thank you.